All right, welcome back to Breakfast Television. The month of March is Colorectal Cancer Awareness Month. It is an important topic to talk about because prevention, of course, is the key to this. And a lot of advances as far as technology goes. I am joined by Dr. Vicky Baffis, who is a gastroenterologist with the MUHC. Vicky, welcome to the show.
Nice to
It's
be
great to have you here. Let's talk about the importance of having an awareness month because it is one of these cancers, as I said, is very preventable, isn't it? Let's talk about the Awareness Month and why we should be raising more awareness.
Well, first of all, colon cancer is a very common disease. So in Canada, it affects about 26,000 people, and 9,000 people die a year. So it's a very common. In women, it's the third, and for men, it's the second most common cause of cancer. So it's a very common thing. And it's something that you can prevent, because if you can find the cancerous lesion and take it out, you'll never get the cancer.
What is the cause of it exactly, or causes? I'm sure there's
I think a big component is genetics, something that you can't control. But of course, diet also helps, that if you can avoid red meat, all the things that are good for overall the rest of your body too. Eat lots of vegetables, lots of fiber, milk is good for you, all these things. But for the most part, really, even if you're perfect, you still need to be screened.
Yeah, let's talk about screening. So who do you recommend get screened exactly?
Okay, so there are different populations. So if in your family you have had cancer or polyps, then for sure you need to be screened. And usually the recommendations are 10 years younger than the first person or the youngest person that had it, or 50.
Okay.
So these people are in a different category, and they really need colonoscopies, and we can discuss that later.
Okay.
But for the regular person who has no risk factors, who feels fine, the recommendations are now at 50 to start some kind of screening program.
So what does that program look like exactly? How often should we be
Exactly.
screened?
So again, if you have had no history, right now in Quebec, what they're recommending is what's called a FIT test that you can get from your family doctor.
Okay.
And it's a stool test. So they look at your stool and they look for traces of blood. And the thinking is that if you have even microscopic amounts of blood in your stool, it's a sign that there's something growing inside.
Okay.
So the chances that we're going to find something if we have to do a more invasive test like a colonoscopy.
Is this the kit that was running on ads as well that you could do from home? You send in 3 samples?
So there's different kits. There's
Right.
also a DNA kit that's not right now recommended, or but this is for the blood kit. It used to be that your doctor would do it in his office, stick his finger up your bum and take it, but now they have a much more specific test and more sensitive test, and it's an immune test. And if that's positive, then you will be sent for a colonoscopy.
Okay, and let's talk about a colonoscopy, because that word frightens everybody, but
Right.
I think with the advancements that we've had now, it's nothing to be frightened about. It's a very simple procedure, really.
It's so simple that most of, at least my patients, but from my colleagues, the same thing, everybody says, oh, that was it? Because quite honestly, it's not fun, because you have to do a preparation the day before.
Yeah, the preparation is probably the worst part of it, by the way.
Exactly.
I've done it twice now because I'm more susceptible, one of those people that falls into that category. But you're right, that's probably the worst of it. I mean, the procedure
and now
itself.
it's even easier because, first of all, there's 2 preparations. There's that big gallon, but then there's these 2 envelopes, and you can discuss with your doctor what you can use. That may make it a little bit easier. And now we even split it, so you don't have to drink it all in one day. You can do half the night before, half the morning of. And really, then you come in to the hospital, there's sedation that makes it so much easier. And then in 15 minutes it's done, and you go to the recovery room and it's over. And you really have maybe saved your life.
I want to talk a little bit about signs and symptoms. Unfortunately, if you have signs and symptoms, you might be in a, it could be in a danger zone, right?
But it makes treatment difficult because either it's bigger or it's more advanced, and God forbid it's already cancer, it's spread somewhere else.
Right.
So you'd like to catch it before. And so saying I have no symptoms is not really a reason not to do it.
What are the symptoms that put you into that day? What would you be feeling?
So the risk factors or the danger signs for us would be a change in your bowel habits that you didn't have before.
Okay.
Seeing blood in your stool, a new pain that bothers you that you should have investigated, weight loss, things like that would be something that would make us worry.
And as you said off the top, I mean, the main thing for prevention is really a healthy lifestyle. We can't say that enough. Eat well, good exercise. You can't
change your parents, so the only thing that you could do is eat a lot fiber and less red meat.
And we should mention as well, there's so many resources out there that are available to people now as well to find out more information on it. Dr. Vicky Baffis, thank you so much for joining us.
Thank you for having me.
Really appreciate it. We'll be back with more VT coming up right after this.